The expectations that are placed on us by ourselves and others leave us feeling like we should already be competent when it comes to our clinical skills. Except we know that we do not feel competent or confident when it comes to our clinical skills. But here, right now, you and me, we are going to sort out this situation to help you to step into confidence before you feel competent for the clinical exam win. Hello Dr. Humans, welcome back to the channel and to today's video where we are going to be unpacking how on earth you feel confident before you feel competent as you approach your clinical exam. You might be thinking, what on earth are you talking about, Christine? Of course you need to be competent to feel confident. And when I feel competent, I am going to feel confident, right? That's just how it works. Anything else would be arrogant, and we don't like those people. And I would tend to agree that being overconfident in areas where you don't have a lot of competence is very annoying and never really a good idea, right? And as doctors, we do need to be showing up in ways which understand our limitations and acknowledge what we do know as much as acknowledging what we don't know, right? We need to do that so that we can provide the best care for the patients. But this video is not about how to show up at the interface of patient care. At that interface, I actually want you to be extremely humble for the rest of your career, right? No matter how experienced you are, humility is an absolute requirement for the best possible patient care, okay? We should never feel like we need to put on any kind of show when it comes to real life patients. We should practice within our limitations and we get help from others when we have reached those limitations. And that's true for medical students all the way to very experienced consultants. We should be phoning a friend or a colleague when the situation demands it. Okay, so I'm actually not talking about being fake and arrogant and having confidence that you don't deserve to have when it comes to looking after your patients. That is not what I'm promoting here on the internet. But what we are talking about today is confidence as it applies to the clinical exam, which is a whole thing in itself, right? It requires a display of confidence. And the people who do the best in the clinical exam, yes, they know their stuff, but what's also true is that the examiners are more forgiving when the candidate appears more confident. It just puts them at ease. I remember when I was sitting my clinical exam and we were doing a bedside tutorial and one of the people in my group was presenting to the consultant and they said something that was completely wrong. It was just wrong. And the examiner nodded along and gave them extreme praise. I was sort of outraged by this at the time, but the truth is it's just human nature, right? When someone says something confidently, we tend to agree with them and rather than question it. Just roll with the confident human. We seem to be sort of built this way. So to pass the clinical exam, you do need to have both confidence and competence, of course. And even if you are very confident, if you don't have the substance to back it up, you will be seen as a hazard to patients at large and you will absolutely fail, okay, as it should be. But the problem with the clinical exam is that medical culture surrounding that exam feels like it was meant to destroy us. Because the truth is that you learned clinical skills at med school. You did some OSCEs, you survived them, you did what you needed to do to get to the other side. Then you started working as a doctor and you did a lot of administrative tasks. And any of those very basic clinical skills that you might have built in the past at med school have all but certainly deteriorated over time. So that's the truth, right? At med school, you were taught clinical skills to a basic level and not to the standard that you require for your physician's exam. And even those minimal skills that you learned back in the day, they're now a distant memory, right? That is the truth. However, when we start to work towards your clinical exam, people around us that we love and respect and look up to give us the very clear message that we should know this by now. And it's not just the people around us, we say this to ourselves. Oh my goodness, a medical student could do that. Why can't I do this? A medical student could do that. Expectations that are placed on us by ourselves and others leave us feeling like we should already be competent when it comes to our clinical skills. And if that's the case, we should be confident, right? Except we know that we do not feel competent or confident when it comes to our clinical skills. We feel like we should know this by now, and we feel like complete frauds. Or at least that's the person I'm trying to reach with this video. If you resonate with what I'm saying, then you need to stay with me so we can sort out this situation and enable you to be confident right here in this moment. And to do this, we need to redefine what it means to be confident. Because the true meaning of the word confident is just the willingness to feel uncomfortable and have your own back. Okay? The willingness to feel uncomfortable and have your own back. Know that you'll be okay no matter what, right? So the best example of this is children, right? If you watch a child try something that they're learning for the first time, the chances are they'll approach this with some degree of confidence, right? Not because they're good at it, not because they know what they're doing or they're competent at it, just because they know that no matter what happens, they'll be okay. They can try something, be imperfect, try it again, be imperfect, but every single time they can get a little bit better. And children do this so easily because nobody's telling them that they should know this by now, and they're not putting that pressure on themselves either. And equally, we can all think of that little child, the one who tries something, they can't do it the first time, and they cry their eyes out, right? And they never want to do that again because they were terrible at it and it just felt bad and they don't want to do it again. And so what's happened there is that this child has a perfectionist mindset. The child has lost it because they are feeling all the things that you feel as you work towards your clinical exam, right? The shame, the embarrassment, the trauma of not being polished and the best at something and people were watching. But coming back to the child who's trying something for the first time with no pressure from themselves and no pressure from others, they're just showing up with the intention of learning something new. And which of those children are most likely to grow in this space, right? It's the child that has the confidence, because that confidence literally gives them a growth mindset. Whilst the perfectionist meltdown child, unless they have an adult come in and reframe this and help them to adjust to this experience and adjust their mindset, that child is going to have a lot more trouble thriving at whatever it was, whatever they were trying to learn that had caused that discomfort. So I want you to think about that for me. Which child are you resonating with right now as you move towards your clinical exam? I think for most of us, learning clinical skills for the physician's exams, it feels like we're learning it for the first time. Like truly learning it, like really meaning it, truly trying to understand all the signs and how it all fits together, right? We didn't really necessarily take that opportunity at med school. Or even if we did, we've now forgotten. So if studying towards your physician's exams is essentially learning something new, and you give yourself the grace to approach it that way, then you get to choose which way you want to show up, right? Do you want to show up with confidence, knowing that this will ultimately create a growth mindset, allow you to feel good while studying, allow you to open your mind to the learning, actually retain it, actually be present in the moment as you learn this material? Or do you want to show up as the perfectionist meltdown child who literally has a meltdown on the inside, if not the outside, every time they go to a tutorial, every time they pick up a clinical exam textbook, basically just every time they look at their tendon hammer, they feel bad about life, right? They are not confident, not because they're not capable of being that way, not because they cannot become competent, right? But they will just have a much more difficult journey showing up in that way. And if I'm honest, I was that one. I was the perfectionist meltdown kid during my clinical exam. I was dying inside because I did not have some Scottish lady rambling at me on YouTube at that time, telling me what's what and illuminating me on the fact that there was another option, right? So I'm here to give you that option. You can feel confident as a means to help you gain competence. And as you do this, your accumulating competence will further feed your confidence, right? It's an ecosystem. It's amazing. You are incredible. You have infinite potential and you got this. And if you are studying for your clinical exam, you're going to need to check out this playlist right here. Be sure to like and subscribe, and of course share this video with a study buddy if it has been helpful for you. Thank you so much for tuning in. Thank you for watching. I hope you enjoyed this and I hope it helped your studies, and I'll see you again next time.